Perfect. Hopefully my video works. We get 8 minutes. Nice. I get time for questions and answers maybe. Okay, so let's start. Stem cell therapy is unlocking the potential of regenerative medicine. We're going to explore stem cells, exosomes, and their application today in this presentation. Stem cells, they can transform into specialized cells such as muscle, nerve, skin cells, which are vital for your regeneration. So what I'm saying is a stem cell can be infused or injected into your body, and it can become a muscle, nerve, or skin. Stem cell therapy is a form of regenerative medicine that uses stem cells to repair and replace damaged tissue. The potential for stem cell therapy is immense, addressing conditions ranging from joint pain to heart disease and beyond. We're actually studying autism with stem cell therapy, which is pretty crazy. The key to healthy life is healthy regeneration. So as we ask in the medical field, what happens when little babies get injured and then all of a sudden they are 3 days later healed, and then they never grow up with a scar? How does that happen? But when an 80-year-old falls and has a broken hip, it can be life-threatening. Those are the questions in our medical field of why from infancy to 80 years old do we not have that ability to regenerate? The key is stem cells. As we're born, we have 1 in 10,000, one stem cell per 10,000 cells in our body. But then as we get older, in our 80s, it's 1 in 2 million. So our ability to regenerate our own healthy cells decreases immensely as we get older. A lot of that is because of what we eat, our activities, and then, we damage our body when we're younger, utilize a lot of our stem cells, and then as we get older, that damage carries on. So how do we fix that? How do we become 80-year-olds that feel like we're 30? That's what I want, right? There are 2 different ways we can get stem cells. One is autologous, which is through our bone marrow and our fat. We can go into the bone marrow, extract bone marrow from our bodies. We can spin it down, get the stem cells, and then we have to put that back into our bodies. So if you did that on me, you would have to bring those stem cells back into me. I can't donate to Ami those cells. So in this, the theory is, when we do this and we're 60, 70 years old, we're pulling our own stem cells. Remember, we don't generate or regenerate very good stem cells. So we're spinning down these broken down cells already, and then we're putting them in our bodies to repair, and they do work, but they don't work great. So what we do at our clinic is mesenchymal cells. These are from the cord or from the placenta. And they are day 1 cells. These cells are brand new baby ones. They are a gift from God, and a gift from the mother, and a gift from the baby. And these cells do not have any designation. So when we infuse them or inject them, they become whatever your body decides it needs, and then it regenerates. And how it becomes whatever your body needs is through cell signaling. What this is when we have a damaged nerve or a damaged muscle, or we have chronic pain, or we have some type of condition like autism, our body sends signals for repair, and it's asking our bodies for the stem cells to come repair it. So let's say you have heart damage, and your heart is asking, please body, send me stem cells to repair my heart damage, and you don't have the ability to regenerate heart muscle or heart cells, it's not going to repair it. So when we do the stem cell infusions or the stem cell injections, those stem cells, because they don't have a designation yet, they will go to the heart, and they will become heart muscle, and they will become heart veins, and they will become heart whatever it needs, whatever your body's signaling, and then it will release exosomes for that repair. So exosomes are actually the power behind the stem cell. The difference between an exosome and a stem cell, though, is an exosome cannot replicate. A stem cell can. So when you do exosomes, if you go to Mexico and you get billions of stem cells, what you're getting is exosomes. And if I'm getting exosomes that are specifically for muscle, then it's gonna repair those muscles, but it's not gonna regenerate. It's not gonna like replicate. But if I get general stem cells that aren't designated, then they're gonna replicate and they're gonna grow in my body. But exosomes are what hold the protein, the lipids, and the RNA. They're the messengers between cells, so they can also repair mitochondria. And they promote healing, reduce inflammation, encourage cell regeneration. In our clinic, we also do exosomes. We can bring your hair growth back by microneedling exosomes into your scalp or into your face or wherever else you want hair. I don't know where that would be, but. And then we also can do skin and bring back the elasticity and the collagen in your skin. And then we can also do other things that are a little more intimate. So the science behind the research. We have research and we have clinical studies that show that stem cell therapy are helping with all these conditions. And I'm sure you know somebody with this condition, right? Chronic joint pain. Anybody know anybody with chronic joint pain? Anybody that's alive? Chronic back pain, bulging herniated discs, spinal cord injuries, arthritis, osteoarthritis, cartilage tears, tendonitis, shoulder injuries, autoimmune, connective tissue, dental applications, wound healing, long COVID, and mental things like autism and sometimes brain injury. So the list goes on, and you can go onto many government websites and see the scholarly articles on how stem cells are actually making a big difference in our health. One of the things I want to say is if it has if you have an injury that is acute, then when we do the stem cells, they go right in and they fix it really, really fast. We're seeing like days of repair, but if you have something that's chronic, it may take more than one infusion or injection for that. So everybody's a little different, but chronic is our bodies are already familiar with that.
Got stem cell therapy because I had a partial tear in my right shoulder on my labrum from 11 to 1, and the doctor said it was surgery. The only way to fix it. So I was hoping to avoid having surgery by getting the stem cell therapy. Since getting stem cell therapy,
he's on the bottom trying to get up on the next one.
In my shoulder. The pain is almost gone. I still will get a few twinges here and there, but it is a lot better than it was. I was really skeptical, but it has surprised me. As of right now, there's no plans for surgery. If anything, I want to find another round of stem cells.
So if you have any questions, feel free to ask afterwards. Apparently I take 8 minutes.